Hello, my name is David Friedman. Welcome to my lecture series, Improve Posture to Avoid Injury and Increase Running Performance. I just wanted to first introduce myself. I have about 15 plus years in the health and fitness industry. I hold a bachelor's in science degree in sport management. I also have a master's in science in exercise science and rehabilitation. I currently train clients privately, and I also work out of a big box gym and have been doing so as a personal trainer and a postural alignment specialist. I hold multiple degrees from ACSM, NASM, and NASE. Um, this lecture series is going to give you a brief overview. It's a three-part series. It will cover first, basically, we're going to go over some of the basics and have you become familiar with posture and what is it and why is it important. Posture deviations, common such as pelvic tilt, hyperextension in the lower back, types of knees. These are just some examples. Rotational distortions, again, another example. And then we're going to go over some of the common injuries related to posture. And then we're going to take one final look before we go to part two, where we're going to just briefly discuss the relationship between injuries and performance. The reason for this chosen teaching form is because of the challenges of the current health crisis, COVID-19, that has ensued, creating it very difficult to have gatherings. And I would have loved to do this in person as a clinic or a workshop. But this will allow you to watch this mini lecture series in the safety of your own home. Also, you will be able to return to the course material as often as necessary to become thoroughly proficient and familiar with the content. Throughout the learning process, you will be encouraged to test your knowledge and recruit friends and families, others to perform some postural assessments. Practicing these skills will obviously reinforce what is being covered. So my hope obviously is after you have watched the entire series that you are able to go out and be confident to either just critically identify postural distortions and use it as part of your skill set, or add it to the skill set, or even if you have some background in like corrective exercise strategy, you'll be able to use more comprehensively posture assessment or posture identification. So with that said, let's get started. All right, so moving on to the learning objectives for the part one of this three-part series. So after watching the entire three-part series, you should be able to identify the 5 kinetic checkpoints in the 3 planes. Be able to identify and describe postural deviations. Be proficient in recording findings from postural assessment. Don't worry about this because we will have designated areas that you'll see little activities for you to do on your own. It will give you an opportunity to test the knowledge that you've been given through this lecture. At the same time, will allow you to kind of get familiar more so with some of the principles that have been discussed in regards to posture. So you will definitely, hopefully, by the end of this, have some proficiency in being able to record the findings. But like with anything else, practice is really the key to becoming better and better at being able to identify certain postural deviations. The next one would be to conduct a postural assessment in the field. So after you've done some of these activities on your own, you should be able to go out in the field and use some of the technology that will be gone over in adding to your tool chest, let's say, of or skill set of being able to work with your clients, whether they be athletes, recreational runners, strength and conditioning novice, or even elite type of people that have been training for a long period of time. Um, then the next one would be familiar with the anatomical phases of the running gait. So that's where we're getting more specific to how posture influences running or running performance, and then also going into, you know, how injury inhibits or conflicts or limitates running performance. So they're kind of one and the same. We'll go over that also. And then finally, describe how posture may affect running performance. So these learning objectives are very broad. I did this purposely so you can kind of get an overview or an idea of what the three-part series is going to go over. So, let's move on to the next slide. All right, so let's talk briefly about the question, what is posture? Um, a lot of times people look at posture as something either good or bad. So let's think about that. Let's think outside the box for a second, in the sense that let's look at posture not being either good or bad. Let's think of posture just being a product of our environment. So, thinking about posture in the early stages of development, when you think of a child or a 4 year old or a toddler, looking at how they walk, how they run, how they, even as simple as bending down to grabbing a toy, you can see that when they're doing it, they're doing it in a matter of being the most efficient comparatively to an adult who has lost a lot of that efficiency over time due to their environment. So, for example, think about in this computer centric environment that we live in today, a lot of people are sitting for hours at a time, 8 hours, 10 hours sitting at a desk, hunched over, typing, not necessarily what we would say is ergonomically correct in the positioning of their chair to their relative to their desk, relative to their computer. So the body being so resilient, again, not talking about bad or good, but the body being so resilient and needing to try to be as efficient as possible, will make changes to the posture, meaning that the musculature will start to develop to try to maintain that certain position and try to maintain it as efficiently as possible. So now let's look at another example in regards to what we would call an ideal posture. So if you're thinking about that person sitting at a desk who is hunched over in a position where the shoulders are rolled forward, the head is jutted forward slightly, the back has a curvature to it, uh, the hip flexors or the hips are constantly in flexion. And then you try to get up from that position and do other natural types of functional movements. Um, the functional efficiency is what I would call it, has changed because of what the body has adapted to. So, is it necessarily bad? No, because if you think about that person who is, or using that example of that person sitting at a desk for 8 hours a day, they can sit there for hours and hours being very efficient because their body has adjusted to that type of environment. So, thinking bad or good or thinking outside the box, we should really kind of take that perspective when we look at our clients or the athletes and what they're doing and how they're standing, or in terms of the static positioning of their body, because that's when you're talking about posture, it's interdependent alignment when you're referring to static posture. When you're referring to like a dynamic posture, that's considered more of a transitional. And that involves obviously all the components of the human movement system. So, thinking about that moving forward. Now, when we're looking and assessing like what has posture been used for in the past and recently, is people use assessing posture as part of a rehabilitation therapy, or mitigating pain from injuries. And then also, a lot of times people will use posture for analysis, not so much related to how, like what we're trying to accomplish here in this lecture is how does that person's posture relate to inefficiencies in their specific movement they're trying to accomplish, and in this case would be running, and that in that sense regarding the analysis portion, the analysis was mainly more attached to the research that that individual is trying to accomplish using posture as one of their forums to get their message out. So when we're talking about posture here, we're looking at ways to improve the posture in order to increase performance in relation to running. All right, so still on discussing briefly again what is posture, and what we discussed previously was taking a different perspective from good or bad posture, and just looking at the posture itself relative to the person's environment. So, with that said, using the example of someone who comes to you who sits at a desk for 10 hours a day, 8 hours a day, their posture is going to be adaptive, or a result of an adaptation from sitting that long. So, looking at those images that you see on the slide, if you see on the left side of your screen, there is an image in the frontal plane showing a skeletal hybrid of a man standing there, showing you basically what an ideal posture will be, where the structural efficiency, the functional efficiency, and the functional strength are all balanced. Just to quickly go over, structural efficiency is basically the alignment of the musculoskeletal system. That's why you get to see that little hybrid image there, which allows the center of gravity to be maintained over a base of support. And if you look at the base of support there, the feet are not separated in a wide base of support. They're basically right directly underneath the hips. The hips are right directly underneath the shoulders. And let's not forget the knees either. The knees are right directly under the hips. So then moving into functional efficiency, that's where the movement aspect comes in. So if the structural efficiency or the integrity is there, then the functional efficiency in theory will also be efficient. So and then moving on to functional strength. Functional strength is basically a result or the culmination of all these. So if the structural efficiency is off, it's most likely because of some of the functional strength being changed. Again, going back to that example used where you're talking about a person who has been sitting at a desk all day, thinking that when you're sitting at the desk, your base of the support is not even really being used. Your hips are in a flexion position or a flex position. Then your torso, your trunk, or your spinal column is going up, whether it's curved forward. Then you have the shoulders rounding forward, head going forward. So these are all like aspects to someone who is adapted to a situation where the body has been forced or is in a position that is really not so much a natural position. We're going to get to that in a moment, but So talking about those little three characteristics, looking again at the pictures or the illustrations, it basically also represents the vertical alignment and shows the vertical alignment of the weight-bearing joints, such as the shoulders, hips, knees, and ankles. What this demonstrates is that the principle that the body is intended to stand upright and bear the load of its own weight and rely on the joints that function and that function at what we would call a right angle. And we're going to discuss that very shortly. But the alignment aspect is very, very important. If you can use the analogy of a house, right? If you're building a house and the shoulders represent the roof of the house, if the roof is tilted, what does that do to the other areas of the structure of the house below it? So it compromises the integrity or the stability of the house when you use that. Now going through to the right angles of what you're seeing there, or the 90-degree angle, it's showing right now in those images a nice balance. Let's just focus right now on the hips of the left image. If you see the lines that are extending out with the little target marks that are showing where the hip joint is, or where the femur goes into the hip socket. And then you look at the trunk of the body, or just above the hips, and then you look at the quads area of the body. That line that's horizontally going through the hips creates a right angle, or a 90-degree angle to the trunk, relative to the leg or the femur area of the illustration. So thinking of that, if that 90-degree angle is violated in any way, meaning that if let's say your right hip is hiked upwards, then you're going to have a less of a degree in regards to that 90-degree angle. And then you can translate that to functional strength, or even tightness or lengthening of muscles, and we talking about the length tension relationship between the muscles. So that would be pretty much what you want to kind of keep in mind when going through the rest of this lecture series, because these are going to be very important points when you start to look and start to identify different postural deviations. So in the next series of slides, what we're going to discuss is some of the common types of posture deviations. This is going to start preparing you to start being able to identify as you start moving through this lecture series. So when we get to the point of doing an actual assessment, and when you're able to do some of the activities that I will give specific instructions to practice, this will start visually allowing you to get more acquainted with some of these posture deviations. Some of you might already know through some of the various or multiple certification programs that are currently available that definitely do discuss some of these postural distortions or deviations. So moving on to the next slide. All right, so let's talk about or discuss the common types of posture deviations. So the first one we're looking at here is forward head. And then the second one would be rounded shoulders. Forward head is basically the forward inclination of the head with the cervical spine. If you could see right there, the hyperextension of associated with the shortening of the upper trap. So you see that in that image that you're looking at. Moving to the rounded shoulder posture is a forward deviation of the shoulders associated with a protracted position of the scapula or the shoulder blades. This is usually caused by muscular imbalances. So going back to functional strength that we discussed earlier. Um, when I talk about protracted too, the shoulder blades being protracted, that's if you can't see it in this picture, but if you looked at the medial border of the shoulder blade, which is that line or that bony structure that is running parallel to the spine, it's basically that distance from the spine to that bony structure of the shoulder blade, that medial border. So some people will measure that distance to see or get more precise, accurate measurements of how far is that shoulder rounded. So that is one way to look at it. And then when we look at, you'll see this in combination when you start doing your assessments. You're going to see both forward head and rounded shoulders. And that's typically referred to what we call upper cross syndrome. So not going too much into like corrective exercise strategy so much, but to just kind of take a look when you have the combination of both forward head and rounded shoulders. That's usually typically referred to as upper cross syndrome. So another common postural deviation that you'll see out in the field when you start doing postural assessments, or you've already seen in your experience, but the first one is called knee valgus, and it's known as knock kneed. As you could see in the image, that the knees are collapsing inward. The next one, which is not as common, is called knee varus, which is bow-legged, where the legs are, or the knees are going outwards, creating that bow shape from the hip all the way down to the feet. Just a quick note, when you combine knee valgus with the foot turned out or both feet turned out, which you'll see an image later on, that is also as characterized as pronation distortion syndrome. You don't need to know that right now, but that's just a little fact that you can kind of look up. Again, it's called pronation distortion syndrome. So now we're going to look at a common postural deviation that is usually a lot of times overlooked because of whatever reason it may be, not having the right equipment to analyze this, or not having the techniques to be able to clearly identify it. So first one is trunk rotation, which is also referred to as thoracic rotation. This is the forward displacement where one side of the trunk is rotated in front of the other, accompanied by one shoulder, arm, and or hand position in front of the other. So if you look at the image, you can kind of see what that means. And images I'm going to be giving to you later on, you're going to see more of this in regards to seeing the hand position, seeing the shoulder position. And again, this is best viewed in the right and left lateral views, anterior, posterior, so the front and the back. Going to the next one is hip rotation, or known as pelvic rotation. This is simply the forward displacement where one hip is rotated in front of the other. So rotation, again, is one of those postural deviations that not a lot of times, or not, is not really identified properly, or it can be mistaken for some other type of deviation. So we'll go over that again. The next common postural deviation is one of my favorite ones because I do see this quite often, and it's actually pretty visually apparent when you take a look at a person from a lateral view or a side view. You can see this quite often in both men and women. So the first one is a forward pelvic tilt, or referred to as an anterior pelvic tilt. Basically, it's the downward tilt of the pelvic girdle, which may be accompanied by an increased um, curvature of the lumbar spine. Um, so a lot of times you'll see that where you'll see, if you look at anybody who has this, their butt kind of sticks out in the back. So that one is pretty common. Another one is a backward pelvic tilt or a posterior pelvic tilt. This one is, um, again, where it's the backward tilt of the pelvic girdle. And this also is usually, or not often, but it can be accompanied by the flattening of the lumbar spine. All right, so here's some common foot and ankle posture distortions. If you look at the top left image on your screen, it'll say foot eversion. You'll see an arrow showing it going laterally outward or curving outward. This is best described as feet pointing outward in the transverse plane. Also, forefoot abduction, or meaning the forefoot is going away from the midline of the body, and it's commonly nicknamed duck foot. The next one, if you look down just below it, it's called foot inversion, which is basically the opposite to eversion. Feet pointing inward in the transverse plane. Also, forefoot adduction, so going towards the midline of the body, and commonly referred to as pigeon-toed. The next one in the top right hand of your screen of the slide is called supination. You've probably heard this if you've ever gotten some shoes, like running shoes or athletic shoes, and put them on by someone who has some knowledge in that. Supination is the outward tilting of the ankle with weight being borne on the outer portion of the foot, and is often, you could say, seen with people with high arches. And then you have below it on the right hand side of your screen on the slide pronation, which is basically the opposite. It's the inward tilt of the ankle with weight being borne on the inner portion of the foot. And that is often seen with people with flat feet. It must be also noted that you need to look at foot and ankle as being one of many, but it is a very important to look and assess it, since it is constantly under stresses from forces, including, like, as you can see on I just gave some of those stresses: body weight, gravity, and ground reaction forces. So that's something to take in account. And then when we go into the other portions of this lecture series, you're going to hear me talking about how important the foot and ankle being a crucial portion of the gait cycle in running. Okay, now that we have gone over some of the common posture distortion, let's briefly discuss some common injuries that are influenced by posture. One of the most common is the lower back. Lower back injuries are commonplace because of the amount of sitting many of us do every day, including myself, or even right now. So in the next few slides, we're going to go over some of these common injuries that you will see out in the field during your postural assessment. Even if you weren't doing postural assessment, a lot of clients will communicate some of these injuries to you. So this will give you a better idea of how, though, to relate posture to injury. So let's take a look. All right, postural issues are a big contributor to many different injuries. Posture itself can be caused by many things, as we discussed before. Adaptation to certain environments, such as if you're sitting at a desk for 8 hours a day, things like that can cause muscle imbalances. But in most cases, a lot has to do with, the lifestyle, sedentary lifestyle. Poor training techniques if you're not sedentary and you're going to the gym. There's many other different types of issues that can play a part in posture and injury. Injuries related to posture tend to be overuse injuries, which build up. And that doesn't mean whether you're exercising or not exercising. This could be, again, going back to your environment or activities of daily living. If you work at in a construction site and you're constantly hammering in terms of the physical aspect, there is a certain muscle or a functional imbalance that takes place because of what you're doing in terms of reaching out with your arm in some cases and continually doing that repetitive movement of hammering. So that's some other way of looking at it other than the sitting at the desk example. Again, over a period of time rather than the more sudden acute form of injury, which is, something like if you pick something up wrong and you have a hyper flexion or curvature in the spine that puts a lot of pressure on the lower back, and you could buckle it, let's say, or we've pulled our back out, or you've heard that term being used. So going forward to the next slides, we are going to talk about neck pain, non-specific. And when I say non-specific, that's just pain that you can't really attribute to anything other than possibly the way you're sitting or the way you slept. Shoulder pain, non-specific also. That's the same kind of thing in regards to maybe the way you slept, maybe the way you sat, getting that crick in your neck, going back to neck pain. That has to do with how you slept, most likely when you wake up with something. So that's just an example. Shoulder pain could be something similar to that, laying on your side, waking up and having some type of non-specific pain show up. Some of the specific type of injuries would be shoulder impingement. Lower back pain can be both non-specific and specific, meaning specific attributed to some kind of form of distortion that takes place. Like also like a herniated disc could be one that can be specific. Then patellofemoral knee pain is usually specific and attributed to overuse. Another, in terms of the foot and ankle, a very common one is plantar fasciitis. So we will go over that when in these next few slides. All right, so we're going to kind of combine the two together, shoulder and neck pain. Shoulder and neck pain, usually non-specific, starts with aching and then stiffness in the shoulders and neck, or just singular, just the shoulders, or just the neck. These are extremely common problems, especially for those involved in desk and computer working. I've been using that over and over again because of the computer-centric environment, and because that I'm still sitting at my desk right now talking to you. So, I mean, that is definitely realistic in the case. So thinking, sitting, staring at a screen for hours on end can fall into a slump position. The rounded shoulders, we talked about that in terms of the common posture deviation, and the neck protruding forward. We also talked about that in previous slides about common postural deviations or posture deviations. So you can think, I mean, I'll just generally speak of some of the muscle function that takes place, but you're talking about, the larger back and neck muscles have a part in the muscle imbalances that take place, such as the trapezius, the rhomboids. Those ones end up working harder in some cases when you get those imbalances. So that is where, again, we're talking about non-specific but attributed to posture. All right, let's talk about shoulder impingement. Now, this is a specific uh, rather than a non-specific, such as just shoulder pain. Um, when we're talking about shoulder impingement injuries, they what happens is it occurs when the space in the shoulder joint is decreased, resulting in a pinching of one or more of the tendons which pass through that space. So that's just kind of giving you a simple overview. There's some research that it also suggests that when you're relating it to posture, um, it has a lot to do with the change in the position of the scapula and the decreased ability for the scapula to rotate upwardly. And that in that case, that becomes when you're trying to do some type of functional movement, um, you're not having that ability to do it properly when you go into shoulder flexion sometimes, and it makes those other muscles have to act, and therefore getting into a position where you get that smaller space, causing possibly shoulder impingement. Um, Talking about just briefly the muscles that are the muscle imbalances that take place when shoulder impingement or before shoulder impingement actually happens. It usually takes place with the upper back muscles, such as the lower trapezius and the serratus anterior. And those muscles tend to be weaker when that happens because of, let's say, again, using that example, sitting for extended periods of time, slouched at a desk. So that would play a role in causing shoulder impingement to happen. All right, going to lower back pain. Remember when I mentioned it earlier, the list of the common injuries associated to posture. Lower back pain can be specific or non-specific. Lower back pain has many different causes. Often the cause of the individual's pain cannot be pinpointed. That's where you're talking about the non-specific. In cases where the pain develops gradually with no history of trauma or overuse, the problem could be just due to poor posture over time. Having poor posture, and again, not wanting to really emphasize poor, but having that posture places extra strain on the muscles and ligaments which support the back. This obviously causes muscle imbalances, which result in muscle spasms, sometimes muscle strain. So think of the most common postural or posture factors to result in lower back pain include a leg length difference. It can happen in the overpronation in terms of the foot and ankle, the pelvic tilts, either forward or backward, which result in either a hyperextension or an overflexion of the lower back. So those are this is just something to keep in mind. Um, so moving on to the next slide. All right, the next common injury, patellofemoral knee pain. Um, this is often also referred to as anterior knee pain. This condition is an overuse injury which results in pain at the front of the knee and is often aggravated by walking and running, and then also climbing stairs. Um, it is most common, or it is said to be most common in women due to their wider pelvis, resulting in an increased angle between the thigh bone and the patella tendon. This is also, it's referred to as the Q angle. Um, there's other contributing factors that go along with patellofemoral knee pain, which includes overpronation at the feet and weakness in the hip abductors, which are the muscles that include the areas outside of the thigh or the quadricep. And these, what happens is, going back to the posture, the valgus knee posture, where the knees collapse in. All right, last but not least, remember we're going over some of the common injuries. So, sciatica or piriformis syndrome. Um, Now, just so you're aware, this is sometimes considered uh, a symptom more than a condition. Sciatica refers to the pain um, down the back of the legs that can possibly cause numbness also at the feet, Um, and the cause of sciatica is usually localized in the lumbar spine, where there's a bulging of a disc that's adding compression or compressing the sciatic nerve. This can happen at the point where the sciatic nerve passes under or through, in some cases, the piriformis muscle in the buttocks. Um, in some cases, the muscle is often overworked and ends up spasming, which results in the compression of the nerve. Uh, the cause of piriformis syndrome includes the leg length differences and then, of course, muscle imbalances, including not limited to tight groin muscles and weak hip abductors. We are near the end of part one of this lecture series, but before we end, I want to briefly discuss how performance and injury are one and the same or coexist as separate variables when measuring overall athletic performance. In part one, we discussed and examined posture, such as common posture deviations and common injuries that occur from these deviations. Although I did not go over direct causes, I did give you a brief overview. When thinking about running performance, one must stay healthy and free from injuries, otherwise, the injuries will limit performance. So that's kind of the relationship that I'm trying to convey to you when looking at posture and performance. To avoid injuries, it is important to understand posture and what the ideal posture is for what is being performed. And in this case, it would be running. So, this is kind of a lead in to part two, where I will give you another overview on how to do a posture assessment. Thank you for watching. Now go to part two.